Our today's topic is prevention and control of infectious diseases, and the learning objective is to define host, immune, and susceptible persons. First question. A 25-year-old woman who recovered from measles in childhood is exposed again to the measles virus. She remains healthy without developing any symptoms. Which of the following best explains her response? A. She is a susceptible host due to natural exposure. B. She is an immune host due to active acquired immunity. C. She is a passive carrier of measles virus. D. She is a susceptible host due to waning immunity. E. She is a reservoir of infection for others. Correct answer is B. She's an immune host due to active acquired immunity. Second question. A 3-month-old infant born to hepatitis B positive mother remains uninfected despite exposure at birth due to administration of hepatitis B immunoglobulin and vaccine. This child is considered A. An immune host due to passive and active immunization, B. A susceptible host due to maternal infection, C. A latent carrier of hepatitis B, D. A reservoir host for hepatitis B virus. E. A chronic infected host. Correct answer is A. An immune host due to passive and active immunization. Third question. During an influenza outbreak, unvaccinated elderly individuals in a community show the highest attack rate. This population group is best described as A. Immune host due to prior infection, B. Susceptible host due to weak immune defense, C. Reservoir maintaining the infection cycle, D. Resistant host due to age-related immunity, E. Intermediate hosts. Correct answer is B. Susceptible host due to weak immune defense. Fourth question. In a dengue endemic region, a 40-year-old man is bitten by an infected mosquito but does not develop disease due to prior infection with a different dengue serotype. What type of host is he in this situation? A. Susceptible host, B. Immune host, C. Carrier host, D. Intermediate host, E. Reservoir host. Correct answer is B. Immune host. Question 5. In a community, 90% of individuals are vaccinated against polio, indirectly protecting the remaining 10% who are unvaccinated. This public health phenomenon is primarily due to A. Reduction of reservoir hosts, B. Herd immunity, reducing susceptible host, C. Transformation of susceptible host into carrier, D. Elimination of intermediate host, E. Latent infection control. Correct answer is B. Herd immunity, reducing susceptible host. Question 6. A person who harbors Salmonella typhi in the gallbladder without showing any clinical symptoms continues to spread the organism to others. How should this individual be classified? A. Susceptible host, B. Immune host, C. Carrier host, D. Reservoir host, E. Intermediate host. Correct answer C. Carrier host. Question 7. A 7-year-old child who has never received a measles vaccine remains uninfected despite multiple exposures to infected classmates. Which of the following best explains this finding? A. The child is a non-susceptible host due to innate immunity. B. The child is an immune host due to prior subclinical infection. C. The child is a passive carrier of the measles virus. D. The child is susceptible host temporarily protected by maternal antibodies. E. The child is a reservoir host. Correct answer is A. The child is a non-susceptible host due to innate immunity. Question 8. In a malaria endemic region, individuals who carry the sickle cell trait show lower infection rates. These individuals are best described as A. Fully immune hosts, B. Partially resistant hosts due to genetic protection, C. Susceptible hosts with environmental adaptation, D. Reservoir host maintaining transmission, E. Intermediate host for Plasmodium. Correct answer is B. Partially resistant hosts due to genetic protection. Question 9. A community achieves 95% vaccination coverage for polio when a non-immune traveler enters the area. No transmission occurs despite exposure. This outcome is best explained by A. Herd immunity protecting susceptible persons, B. Elimination of the infectious agent, C. Conversion of susceptible host into carriers, D. Genetic resistance in the population, E. Passive immunity in newborns. Correct answer is A. Herd immunity protecting susceptible persons. Our last question is, a 50 Year-old man develops shingles years after having chickenpox as a child. This indicates that A. He remained an immune host with lifelong resistance. B. He is a susceptible host due to waning cell-mediated immunity. C. He's a carrier host transmitting varicella virus. D. He's an immune host experiencing reinfection. E. He has innate immunity against herpes viruses. Correct answer is B. He's a susceptible host due to waning cell-mediated immunity. Thank you.